Hi, my name is Haley Roberts, and for my Anatomy 2 project, I'll be going over the muscles of the pelvic girdle and lower limb. The first muscle I'd like to go over is the gluteus maximus. This is the largest muscle in the gluteal region, and the origin is the ilium and the sacrum. The insertion is the gluteal tuberosity of the femur, and something that helped me remember that is the gluteus, gluteal tuberosity. It has gluteal in the name. And then the action is it extends the hip. So I think of when you're going to the gym and you do the glute kickbacks, you're using the gluteus maximus. You're using the large part of your glute when you're kicking back, so when you're extending your hip. The next muscle is the gluteus medius, which is the smaller muscle of the two gluteal muscles we'll be going over. The origin is the ilium, the insertion is the femur, and the action is it abducts the hip. And something that helped me remember it abducts the hip is if you're doing clamshell exercises, you're opening up your legs, you're abducting them, you're moving your legs away from the midline of your body. Next muscle is the iliopsoas muscle, which is the area highlighted in green. So the origin of this muscle is the iliac fossa of the ilium, and you could think about how the ilio and iliopsoas kind of sounds like iliac or ilium. They kind of sound similar in the beginning. So the origin is iliac fossa of the ilium and the vertebra T12 through L3. The insertion of this muscle is the lesser trochanter of femur, and the action is it flexes hip. So you could think about how the iliopsoas muscle is so close to that hip area, it flexes the hip. Its function is going to be able to bring your leg up. This next muscle is the sartorius muscle, which we are pointing at and is highlighted in that dark red color. The sartorius muscle looks like a stripe going across the leg muscles of the body. The origin is the anterior superior iliac spine of ilium. It inserts in the tibia, and the action is it flexes hip, laterally rotates hip, and flexes knee. One way you can execute all three of these is when you're sitting down and you are bringing one leg across the other leg. So that will be flexion of the knee because your knee will be bent, your hip is going to be flexed as well, and then you are bringing your leg across. So that is going to have your knee point outwards, and that will execute the lateral rotation of the hip. The next muscle is highlighted in pink, and that is the adductor magnus. You can see it originates in the pubis area and ischial tuberosity of ischium. It inserts in the femur, and it adducts the hip. So you could think about how close that muscle is to the inner parts of your thigh. It's going to adduct the hip. Its function is going to be to bring your legs towards the midline of the body. Next muscle, we have the gracilis, which is located right on the inner thigh area. The origin is the pubis. It inserts at the tibia, and the action is it adducts the hip. So you can think of it, since it's close to the adductor magnus, both of those areas are close to the inner thigh region. It's going to adduct the hip. It's going to bring the legs towards the midline of the body. Next, we have the sciatic nerve, which is that nerve in the yellow, which starts in the lower back gluteal region and runs all the way down the leg to the foot. It is the largest nerve in the body. This next muscle in the front of the legs is the quadriceps femoris. Quad meaning four, ceps meaning head, so quadriceps means four heads. And this muscle has four different quad muscles, which we'll talk about more in depth later. So the quadriceps femoris, it originates on the femur and ilia. It inserts on the tibial tuberosity via patellar ligament. So patellar ligament, that is I think about how it's by the patella. Patellar ligament kind of sounds like patella, so that's by the knee area. And the action is it extends the knee. So I think about the leg extensions, the leg extension exercise at the gym. You're extending your knee, and that's what's isolating the quad muscle. So the leg extensions at the gym, when you're bringing your leg up, you're extending the knee. That's the action of the quadriceps femoris. In this image, I use bodybuilders' legs, so you can see the defined four different heads of the quads. I outlined them in a light blue color, a red color, and a pink color. The first quad muscle is the rectus femoris. That is the one in the dark red color, which originates anterior inferior iliac spine. The insertion is tibial tuberosity via patellar ligament, and the action is it extends the knee. And the quad muscle that is deep to the rectus femoris is the vastus intermedius, which originates on the femur, inserts at the tibial tuberosity via patellar ligament, and the action is extends the knee. Next quad muscles, we have the vastus lateralis and the vastus medialis. So the vastus lateralis is going to be on the lateral side, so that's the light blue color, the light blue outlined quad muscle. The origin is going to be the femur, inserts tibial tuberosity via patellar ligament, and the action is extends the knee. Last muscle on the medial side is going to be the vastus medialis, originates at the femur, inserts tibial tuberosity via patellar ligament, and the action is it extends the knee. And a tip to help you remember the origins is all of the vastus quad muscles, the ones that start with vastus, like the vastus lateralis, vastus medialis, and vastus intermedius, they all originate on the femur. And all of the quad muscles, which includes the rectus femoris, all four of the quad muscles, all insert at the tibial tuberosity via patellar ligament, and they all extend the knee. So the knee extension is going to be an action of all of the quad muscles. Next, we have the hamstring muscles. So this includes 3 different types of hamstring muscles. We have the biceps femoris, semitendinosus, and semimembranosus. The biceps femoris muscle is on the lateral side, the lateral hamstring muscle, and it originates on the ischial tuberosity of ischium. It inserts the lateral condyle of tibia, and it flexes the knee. The semitendinosus muscle is on the medial side of the hamstring muscles. It originates ischial tuberosity of ischium, inserts medial condyle of tibia, and the action is it flexes the knee. The semimembranosus is deep to the semitendinosus. It originates ischial tuberosity of ischium, inserts at the medial condyle of tibia, and the action is it flexes the knee. All of the hamstring muscles share the action of flexing the knee, and all of the hamstring muscles share the insertion of medial condyle of tibia, except for the biceps femoris is at the lateral condyle of the tibia. Semitendinosus and semimembranosus are both on the medial side, so they are going to insert at the medial condyle of tibia, and since the biceps femoris is on the lateral side, it's going to insert at the lateral condyle of the tibia. This next muscle is below the knee. It is the tibialis anterior. So it is on the anterior side, looking at the body anatomical position. It originates at the tibia bone, and it inserts a metatarsal 1. So you can see how the tibialis anterior muscle goes down to the metatarsal 1, and the action is dorsiflexion and ankle inversion. This next muscle is the peroneus longus, which also goes by fibularis longus. So you can think about fibularis longus, it's going to be by the fibula area. And so that means it's going to be more lateral, while the tibia is more medial. So this originates at the fibula. It inserts metatarsal 1, so same insertion as the tibialis anterior muscle, and the action is plantar flexion and ankle eversion. So the actions of the peroneus longus is going to be the opposite of the actions of the tibialis anterior. These next 2 muscles are the gastrocnemius and the soleus muscle. The gastrocnemius is going to be superficial to the soleus muscle. Gastro means belly, so you can think about how the gastrocnemius kind of looks like 2 belly. The origin of the gastrocnemius is going to be the lateral epicondyle of the femur, as well as the medial epicondyle of the femur, and it inserts at the calcaneus, which is the ankle, via the calcaneal tendon. And the action of the gastrocnemius is going to be plantar flexion. The soleus originates at the tibia and fibula, inserts at the calcaneus via the calcaneal tendon, and the action is plantar flexion. So the gastrocnemius and the soleus both share the action of plantar flexion, as well as they both insert on the calcaneus via the calcaneal tendon. This next muscle, which is also going to be on the lateral side of the leg below the knee, is going to be the extensor digitorum longus. So digitorum sounds like digits, so think about how it's near the feet, near the digits of the feet. The origin of this muscle is going to be lateral condyle of tibia and the proximal fibula. It inserts middle and distal phalanges of toes 2 through 5, and the action is extends the toes. So extensor It is an extensor, so the action is going to be extension. So the action of the extensor digitorum longus is going to be to extend the toes. I also wanted to go over a few of the tendons. So this is the Achilles tendon, which is located by the calf and heel bone, and it also goes by the calcaneal tendon. And I wanted to show you the patellar tendon, which is located below the patella. And you can see the quadriceps tendon above the patella as well. And that is a wrap on my Anatomy 2 project, going over the origins, insertions, and actions of the pelvic girdle and lower leg muscles. Thank you so much for watching.